You must have got a blood test sometimes in your life, either when you were sick or just as a part of a routine body checkup. Sometimes in your life, you must have got a blood test done. Now, the question is why you should get a blood test done or when you should get your blood tested and what all things your blood can tell you about your health. We will be talking everything about it in detail in this video. So watch the video till the end and you will be getting some very important health tips, also some very important. Hello friends, I am Dr. Mehta, a consultant physician, diabetologist and a critical care specialist, and you are watching Doctor Plus, where I'll be a doctor plus something more and we'll be talking everything about good health and everything good about health. So first things first, why do you get your blood tested? There are two main reasons. First, if you're already going through an illness or a minor sickness, for example, an abdominal discomfort or a fever, cough, cold, generalized uneasiness, loss of appetite, anything, and that is an ongoing illness, to check whether what's wrong, we go for a blood test. The second reason is if you are going through a chronic long-standing illness, for example, diabetes, blood pressure, thyroid, cholesterol or a heart problem, to check whether the ongoing chronic long-standing illness is going fine or not, or if it is above or below the range. But there should be, in fact I would suggest there must be a third reason as well. If your age is above 40 years, get your blood test, a routine blood test, done once a year regularly. Yes, this is very important. The reason being, it picks up those chronic long-standing illnesses I recently mentioned at a very early stage, where you can strongly apply lifestyle modifications and such diseases can be controlled at an early stage. Your blood can tell you an entire story about your health, but the thing is, we should be ready to hear that story. So having known why is it important to get a blood test done and when is it important to get a blood test done, we'll now be talking in detail about what a routine blood test should include. Starting with the very first and the most common test, a complete blood count that should include your hemoglobin. Second is a liver function test. Third is a kidney function test. Fourth is a prothrombin time that decides your bleeding and clotting time. Fifth is a average 3-month average blood sugar level, that means an HbA1c level. Sixth is a sodium and potassium, that is electrolyte levels. Seventh is a urine routine and microscopy test. Eighth is a serum thyroid profile that includes serum TSH, T3 levels and T4 levels. Ninth is a lipid profile that includes cholesterol and triglyceride levels. And the last, 10th is a total protein level that includes albumin and globulin. So this makes a list of the routine investigations that must be done every year if your age is above 40. Now, as we can see, most of the health conditions that can be diagnosed from these tests are lifestyle disorders and chronic long-standing disorders. It is very important they should be picked up very early. And if at all they are picked up early, lifestyle modifications and corrective measures can be applied early. Because the major thing about these disorders is that they stay asymptomatic for quite a long period. Asymptomatic means that the patient doesn't have any specific complaints regarding these disorders, especially when we are dealing with diabetes, cholesterol and high blood pressure. But the long-standing consequences of these disorders could be very hazardous. So it's very important they should be picked up early, and these tests can prove very vital in getting the knowledge about these disorders at a very early stage. You'll be surprised to know that these tests can predict a forecast regarding progression of diabetes, for an example, at a very early stage, that can pick up high sugar levels in pre-diabetic ranges. For example, if your blood sugar level of HbA1c is 5.8, now the pre-diabetic range is between 5.7 to 6.5. So if you are in the pre-diabetic range, we can have an easy forecast that 5 years or 4 years down the line, you might be getting into the diabetic range if you don't follow a healthy lifestyle or a healthy diet. So let me give you a calculation. A simple 1000 or 2000 rupees blood test can give you a vital information, vital forecast on diseases like diabetes, thyroid, cholesterol, and heart problems. However, when these diseases are in the late stage, you could go through very life-changing complications like a kidney failure, a stroke, a heart attack. And in those times, you can just not imagine how much high the cost of these diseases, cost of these complications would be. Rather, if we at all don't focus on the cost, the comorbidity it brings is priceless. And trust me, the prediction made by these blood tests is not some astrological prediction. It is a hardcore scientific and evidence-based prediction to forecast the presence of or absence of these diseases. Also, I would highly recommend that once you get these blood tests done, don't just keep it with yourself. Consult a qualified doctor along with these tests and get the advice on how to go about, if at all there is even a minor derangement in any of these tests. It is very vital you keep a track of these tests regularly so that you can lead a healthy and a happy life. So, I am pretty sure almost all doubts and questions about your routine blood tests are now clear. I am Dr. Jai Mehta, a consultant physician, diabetologist, and a critical care specialist, and signing off for today from Doctor Plus, where I'll be a doctor plus something more, and we'll be talking everything about good health and everything good about health. Do subscribe to our channel, do like the videos and share the videos to everyone you feel this video might help. Also, do comment your doubts on health and disease. I'll be more than happy to help. See you till the next time, and do take a very good care of yourselves. Bye.